Hello.
Hello, everybody out there, and welcome to another Gray Muzzle monthly webinar. I'm Denise Fleck. I'm the interim executive director of the Gray Muzzle organization, and I am super delighted to present an amazing veterinarian and also a fellow board member of Gray Muzzle,
Oops.
Dr. Ashley Ackley. And many of you saw her webinar last month. And this is really part two of it because she has so much to share. Dr. Ackley is a veterinarian in Colorado, and she's a small animal veterinarian. But she's a lover of all kinds of creatures, great and small. And let me get the adjectives right, especially the stinky, lumpy, crunchy, and gray faces of senior canine companions. So we're delighted to have her here to help sort out some of the testing that we're often asked by our own veterinarians whether or not we want to do. And it's like, well, do we do this blood test? Do we do, the age test? Are DNA tests accurate? Ashley's going to answer all of those questions for us, or at least start to scratch the surface on them. I don't want to promise too much in an
Yeah.
hour. And if you have any questions, please put them into the chat box for us. We'll pick them up at the end. But I'm going to sign off and let Ashley take it over. Dr. Ackley,
Aw.
away.
Thanks, Denise. And thank you so much for all the work our Gray Muzzle team is doing right now. Like Denise said, let's see here. I just wanted to put this slide out because we've had a great year. And obviously, our goal is saving and improving the lives of senior dogs nationwide. So in 2024, we gave out $1.1 million in grants to 100 animal welfare organizations, which is wonderful. So we've awarded over $5.7 million since founding in 2008. And so, our vision is a world where every senior dog thrives and no old dog dies alone and afraid. So I'm really happy to be a part of this organization and happy to be here with you today. Um, like Denise said, I'm a small animal vet in Denver, Colorado, and we have right now two senior dogs and a squish face cat, which we'll talk about. You will see a lot of my animals in this and a lot of their stories because I've done a lot with them in terms of workup, and also I. Just don't know in terms of what I'm allowed to say and not. So a lot of it's about them, but hopefully you find this helpful. Things that I am not a geneticist. I'm not a mathematician, an oncologist. So I am a vet. I do this and we have these conversations with owners every day. But some of this information for me is even a lot to take in sometimes. And it's so complicated. I think we want everything to be very black and white. And that's not the way veterinary medicine works. I'm also not a computer person at all. I think my 8-year-old nephew would be appalled at my PowerPoint presentation. So I'm sorry if there are picture vomits or word vomits, and it's a little disorganized, but that's kind of the way my mind works. I can talk really quickly and I can also babble and go off on a tangent. So I hope you find this helpful. I do feel like going back and listening to the first presentation might give you some information too to kind of piggyback onto this, but certainly you don't have had to have listened to that one first to be where we're at today. So one thing I was going to say, if you have a Halloween picture of your dog, I would love to see it. If you want to put it in the chat so I could look at that later, I would love to see them. That's one of my favorite holiday, one of my animals' least favorite holidays in our house. So, and I wanted to bring this up. I'm extremely passionate about client education and what we call spectrum of care in veterinary medicine. It's a little bit different than gold standard or standard of care. We're kind of changing things because there's so many different factors that go into how we make decisions around our pets. And for me as a practitioner, I really want to make sure that all of these things come together and we make the best decision for you, for your family, for your pet, with where you're at and with the options that you have available. And so I really love this chart. This comes from uh, just kind of a newer discussion in veterinary medicine around how do we make sure that people feel like they have options and still feel like they can do what they need to for their pet with what they have and where they're at. There are a lot of things that go into that. So this is some of the stuff we'll be talking about today in part two. I'm really hoping that there isn't a part three, four, five, six, because this could just keep going. There's so much information out there, but hopefully you get something out of this. And these are some questions that we answered today. So senior screening diagnostics. So this is what I talked about last time. A lot of times you'll hear us talk about, oh, doing screening blood work or annual blood work for your pet. And so most commonly we talk about a CBC and a chemistry. And sometimes a urine's included in that. And then some of these are other tests. This was all on last lecture, but I just wanted to kind of bring this back up as, gosh, these are things that you hear pretty commonly in veterinary medicine these days about doing some blood work to look at organ function and all of that. So these are screening things. Oftentimes that means nothing's really wrong. We're just looking to see if there are changes and looking to see if there's anything we can, do about those changes or if we just monitor them. So again, sometimes nothing has to be wrong for us to recommend these things. So what does it mean and what do we do if we find something abnormal? And this is where, again, I think it totally depends. We could have one piece of the puzzle and we could say we need more information. It could depend on the severity. It could depend on where you're at and your family's at, or your dog and their quality of life and what they'll tolerate. We're saying, well, you need to bring your, Fluffy back in for 20 different tests. Maybe Fluffy hates the vet and doesn't want to do that, and that's not something you want to put Fluffy through. And so this all goes back to the spectrum of care model on the right. Just really talking through those options, knowing your options, knowing where you're at, knowing where you think your pet's at, and making those decisions together. Again, the biggest thing is quality of life. But I think sometimes what I hear is, okay, if we do blood work, what does that mean? There's so many different outcomes and options, and that can be hard. But I do feel like sometimes owners do want more information to be able to make those choices. So, in terms of what we'll be talking about today, we'll be going through some imaging. So, we'll talk about x rays, ultrasound, and echocardiograms. I did write out when we say x ray, sometimes we'll say RADS, radiology, ultrasound, sometimes it'll be abbreviated, an echocardiogram or a cardiac ultrasound. Sometimes you'll hear us just say echo. So I just wanted to make sure that that language was out there as well. So these are my images that I have come to find interesting, and hopefully you'll find some of these interesting too. So this is a little kitty actually in the, oh, I don't have a pointer, do I? Well, in the center, this little cat's sternum is actually lifted up into his little chest. We can see this. This cat was maybe 6 to 8 months old. Sometimes this can be really, really detrimental to them, but this little guy was doing just fine. Just felt something weird and went, oh my goodness. And then on the right side, those are gallbladders. Those are on ultrasound, and those are actually dogs that were having anaphylactic reactions to bee sting, insect sting. And so it's just one of those crazy things that I was able to look at and say, oh my gosh, this dog's having an anaphylactic reaction based on an ultrasound. So I thought those were kind of cool. Again, if you don't know what you're looking at, this looks like absolutely nothing. And I don't expect anybody to be a radiologist by the end of this by any means. So let's talk a little bit about x-rays. So x-rays, probably one of the most common imaging tools that we use. And it's because it's accessible. Most places have them. A lot of times we'll use it for a screening tool, meaning that nothing's really wrong. We're just taking a look. And then oftentimes we'll use it when an animal is sick. It's pretty easy to take x-rays of a chest or a belly. It's a 2D image, so a lot of times we need to take more than one x-ray view. So these pictures on the right are both animals laying on their sides. And I can tell some changes are there, but I would need to have them on their back or their belly to have another view to really know exactly where these things are, what changes are and where they're at. And it's better when there's contrast between density, so bone or air. And that can be kind of hard to explain, but on the top here, there's a white line and then there's a big black spot, a big black space on top. And then you see the rest of the body, you see the spine and everything else. And this dog actually has air in his what we call subcutaneous space. So between his skin and the rest of his tissue, he has a tear in his trachea, and it's caused air. He basically blew up like a balloon. And I can look at this x-ray and say, oh my gosh, there's air everywhere. This dog did okay, actually, but pretty crazy x-ray. Then on the bottom, this is a dog that ate a bunch of rocks, and these rocks are in his stomach right now, and they're starting to go into his intestines. This is an x-ray is a snapshot in time, meaning that, gosh, if we were to retake this x-ray in maybe 30 minutes, an hour, 5 hours, this could look a lot different. And so we always have to keep that in mind. So, so when we are looking at x-rays, we can take them of a lot of different parts of the body, uh, and we often do. The most common place, I guess I would say, that we take them pretty consistently is the chest or the thorax. So basically where your heart and your lungs live. And so we can take them when we find something abnormal, or we can take them because we're looking just to make sure there's nothing abnormal. A met check, sometimes you will hear us say that, especially with senior animals, senior dogs. And basically, what a Met check is, it's taking pictures of the chest to look for cancer, spread of cancer, or metastasis. So, cancer a lot of times likes to spread to the chest. Sometimes that can be the first place we find it. A dog can be completely normal, and we say, hey, we should do a Met check. We should take some chest x rays before surgery just to make sure, because this is a big surgery. And we'll take something and find something abnormal there. And so, I do think it's ideal if your vet is recommending that. Sometimes they'll just recommend it as a screen. Hey, let's just do this every year just to monitor changes and make sure we're not finding anything. Because sometimes cancer can be really, really tricky to find, and it's not always easy to find anywhere else. And the chest is a place we can look. We'll talk a little bit about abdomen and belly in the ultrasound section. We definitely take x-rays of these areas, but sometimes it can be really, really hard to see things. It's just a big whiteout in there. And so ultrasound's a little bit more sensitive for that. And then bones, arthritis, probably the most common thing we see on the right side. Those are my dog's hips. They are horrible. He has hip dysplasia. They're not as bad as my lab before that, but they're pretty bad. Um, and then on the right side, that was our hospice dog Owen. Uh, so he had a mass on his toe, and he was at the shelter, and they took chest X-rays, and they didn't see anything. They said, "Okay, well, let's take this off." So they took his toe off, and it came back melanoma, which is actually a really bad cancer. And so we adopted him knowing that he had this. I took his x-rays to a radiologist and said, there might be something there. We repeated x-rays, and as it turns out, even from the first x-rays, which he was only able to see, I was like, oh, maybe there's something there. I don't know. But then it had changed, and he said, yeah, that was definitely metastasis. So he was only with us a month, but we loved him very much. And again, that's something that was helpful to know. Gosh, it's already spread to his chest. His prognosis is not good. And on the bottom right there, that's a dog that does have metastatic cancer. I don't know, between the left chest picture and the right one, if you can tell the difference. It's very fuzzy, and there's whiteouts, and sometimes you think you can see little round nodules. That's more consistent with metastatic cancer. Sometimes we'll see that with fungal, but it's much less common. So sometimes it's helpful to have a radiologist review x-rays, like in Owen's case. So I bring that up because sometimes a vet will say, hey, we need a second opinion on this. And I think it's always nice to have. We're starting to see AI do this for us as well. So that's a new tool in veterinary medicine, is that AI is reading x-rays as well. Um, but again, sometimes there's just a lot on an x-ray. Even though we go to school for it, a radiologist has gone 3 years and done more extensive training. And so it's something that we often will recommend. So, and then I just put more x-rays. X-rays are fun. And sometimes when you can see things, it's pretty dramatic. Some of these are not as fun, but on the upper left, there's a dog with some bladder stones. There's a circular area and all these bright little round things in it. That dog had so many bladder stones, and if you touch the bladder, it would jingle. The first sign that the owner saw was, oh gosh, maybe he was straining a little bit and there was a little bit of blood in his urine. But it took a long time. Those have been there for a while and there's so many of them. In the middle, there's a dog that or kitty, I think, that had an elbow dislocation, was able to be fixed. Uh, and then on the right, that's my dog's chest, which is not completely normal. But just below that is another picture of a chest that you can't even see the heart. On the upper right, you can kind of make out a round circle in the middle of Dollar's chest, and then below it, you can't tell what that is. And that's that dog had a chest mass. This needed a second x-ray on the other side because this was only on one side, but I would never know it from just one view. And then on the bottom middle, that's a puppy that swallowed I think it was a baking instrument, something you'd use to like ice a cake. That thing is huge compared to that dog. I can't tell you the centimeter. I can't read it, but that dog had to go get that scoped. And then on the lower left there, that's a dog that does have a mass in his belly. I can't tell you where it is. I can give you an idea. Maybe it's honestly, but I don't actually know. And that's where ultrasound comes into play. That's something that we can feel. A lot of these are things that I could tell on an exam, but not always. So need more information on a lot of these cases, and that's why X-rays were taken. Just a quick word about dental X-rays. I think these are so important, and I think it's becoming hopefully more mainstream to do dental x-rays. So these are my animals doing fun dental things, showing off their teeth. And the reason x-rays are so important is there's so much disease below the gums, and you can't see that just by looking. On the lower left-hand screen there's actually a picture of a tooth that was taken out, and then there's one root that's completely gone, and then there's another root that's still there. I wouldn't have known that unless they took an x-ray. And so I do strongly recommend that if you are having your dogs, if you're having a dental done, talk to your vet and make sure they have dental x-ray and they're using it. A word about the anesthetic-free cleanings too. Those don't do much. And I know it's scary to think about doing anesthesia on your pet, but it's something that your money is probably best spent doing a full cleaning under anesthesia and having x-rays taken and probing versus taking some of that tartar off anesthetic free. I know that we want to do that sometimes and it feels good, but if you're not getting under the gum line, that's not really helpful and it's not comfortable for the pet usually to do that anyway. So it's just again something to talk to your vet about, and most places are now have the capability to do dental x-rays, but there's just a lot to see under the gum, and that's why that's so important. This is an example of my dog. So every year, Gray Muzzle does the Summer Smiles campaign, and I love this because I love Tilly Terrier, and I think she's very cute. So I take tons of pictures of her. So she's sitting on my husband's lap. I have 20 pictures of her, the same pose, looking cute, smiling. And then I went, oh my gosh, her tooth is missing. Where did her tooth go? She just had a dental 6 months ago. Then I have 20 pictures on the upper right and see, oh my gosh, I think she's missing a tooth. So I spent 20 pictures trying to take a picture of that, being like, did she lose a tooth? Does she have a mass? How did she break it? Is she acting funny? A lot of times animals don't react to anything. And so that can be a really hard thing to determine if they're uncomfortable. So this was her fractured tooth. And yep, she just snapped it right off, had no idea how that happened, found it on her gray muzzle photo shoot. And then the other thing that I found was an abscess tooth, which 6 months ago it looked fine. And so things can change pretty quickly. So I'm glad that I did that, glad that I know. Oops. So ultrasound, moving on to ultrasound. Uh, this is great for the abdomen or other soft tissues. It's great for detail. It's more sensitive than an X-ray. And so we see a lot of good detail with the organs. So if we're looking more closely at the stomach or the intestines or the bladder, it's really, really helpful tool. And again, becoming a more common thing that we recommend. So say your vet says, oh, your dog has some liver enzyme elevations or changes. An ultrasound might be a great way to look more closely at that. And so on the right side, you can't tell because if you have no context, these just look like blobs, but these are all abnormal kidneys. And the thing about ultrasound is that it's in real time. So I'm going to see if this video will play. Um, let's see. So, oops, I probably should have, I don't know how to turn the volume off on that, but this is my dog that had a normal part of her kidney, and I started to feel something, and then there's a giant mass that is on her left kidney on the left. It starts to show up. So yeah, that's a big mass. Again, I don't know if you can hear me, but that's something that I wouldn't have known where that mass was. I wouldn't have known what it was attached to. I can just kind of see it on an X-ray, but ultrasound is really the way to go. Echocardiogram, echocardiogram or an ultrasound of the heart. Why do we do this and why do we recommend it? So it's probably the best way to look at heart function and to know exactly what type of heart disease your pet might have. There are so many different types of heart disease. And so really what we're trying to get to is how well is the heart working? It can also tell us, the severity and if there are any masses or anything like that. But why do we do this? You usually hear something, maybe your vet says, oh, your dog has a murmur, or gosh, they have an arrhythmia. Maybe we find it on another diagnostic. So maybe we see some changes on an X-ray or a blood test. There's a heart marker that we talked about last time. Sometimes we use this as a screening tool, although much less common. Usually, if we're screening, they're high risk dog breeds. So Cavalier King Charles, poster children for heart disease, unfortunately. But a lot of times, we start actually recommending screening them if it's feasible, so we know changing. And then if your pet's undergoing anesthesia, sometimes your vet will recommend it. This is my dog Dollar, and you can see a little shaved spot on his right side because he had an ultrasound, a cardiac ultrasound or an echo of his heart. And then basically the cardiologist or specialist usually writes a report with a bunch of random words that I don't even understand, but I know the diagnosis. So this is my dog Tilly, and so she does have a certain type of heart disease, and it's staged, so we know more about it. And the reason I bring this up, this study, this is again a lot of information you don't need to know. But small breeds are really prone to heart murmurs and a certain type of heart disease. And we use a medication called pimobendan when dogs have gone into heart failure. And this study, which became quite famous, it's called the EPIC study. It looked at, gosh, we would usually start this pimobendan medication after a dog has gone into congestive heart failure. So congestive heart failure, they're coughing, they're having trouble breathing, they have fluid in their lungs. It can be really, really traumatic, I think, for the dog and for owners. And so they started looking at, gosh, what if we gave this medication before heart failure started? What if we started giving this when these dogs were maybe they had some changes on echocardiogram? You can do this on an X-ray sometimes, but a lot of these were done on an echocardiogram or an ultrasound of the heart. So they did start giving these dogs medication at this B2 stage, and it actually prolonged these dogs on average 15 months before they went into heart failure. And so we were able to catch them and start treating them earlier. And this really kind of changed at how we look at veterinary medicine um, with this certain type of heart disease. So now when I hear a heart murmur, I do recommend an echo more frequently than I used to because there's something that can be done now that may keep your dog living longer and more comfortable and out of heart failure for over a year um, than if we didn't have that information. Again, just because we say this was done with an echo or an ultrasound of the heart, not everybody can do that or has access to that. And so there are other ways to monitor with x-rays and things like that, but it's something to know now. Like, wow, but gosh, that's pretty impressive. I was impressed with this. At least I hope that this comes off as something that is pretty cool. So other common tests we're not going to talk about, but again, this veterinary medicine is going in the way of human medicine. There are all sorts of tests and options out there, and it's really what does this all mean and what do we do? It really goes back to having those conversations with your vet we're talking severity, we're talking, is there variability in breed or age? Where are you at? Where's your pet at? And what other information might we need? So trying to gather that up is important. And making those decisions together, and just knowing that, gosh, just because we do all this doesn't mean we're going to either have an answer or have a good outcome. And sometimes we do everything, and it doesn't make a difference. So where are you, and what options are out there, I think is important. So talking to your vet is a really important thing, having that good relationship. So I think everybody's been waiting for this part, but can blood work tell me if my dog has cancer? Maybe we're getting closer. This is a whole big thing that, I mean, I hear this often, and there's a really sad joke in veterinary medicine. Sometimes, I don't know, sad, I don't know if it's a joke, but sometimes you'll have completely normal blood work. You'll be like, of course, the nicest dog, nicest owner, normal blood work, this dog has cancer. Um, so our routine blood work that we do, a CBC and a chemistry, rarely does it tell me if a dog has cancer. Sometimes it will tell me, gosh, there's a change here and we need to investigate this further. So this goes back to my last talk, is my dog anemic? Are the kidney enzymes elevated? Is the liver enzymes elevated? Are the liver enzymes elevated? Maybe then your dog could have cancer, but it could be a list of other things. So we need more information. Um, my lab with the kidney mass, completely normal kidney enzymes. You have two kidneys, um, and so no effect there. So I have seen on occasion on what we call a CBC, sometimes, maybe 3 times in my career, I've seen a dog that has had a lymphoma or a leukemia that has shown up on blood work, and you've gone, oh my gosh, this is an abnormal number of cells that shouldn't be there. And you look under the microscope and you go, oh gosh, this is not good. Very, very rare and uncommon though. Um, the other thing that we are starting to see more commonly in veterinary medicine, which I think has also been a topic in human medicine, is this thing called a liquid biopsy. And it refers to the use of biological fluid. So most commonly, we're talking blood, and it looks for certain pieces of cancer, whether it's cells or um, certain types of DNA markers, all sorts of different parts of cancer that might be in these certain places like blood. And so I bring up these two tests, the Nu-Q cancer screening and then the BRAF test. Nu-Q we're going to talk about. Right now, it's the only one on the market in veterinary medicine that's available. The cadet BRAF test is actually a urine test for certain types of urinary or urethral cancers, so more specific. So this new Q test, um, again, it's the only test right now that's on the market. There was another one called OncoK9 that was expensive. It tested for more potential cancers, but came off the market. I don't know when, maybe within the last year or so. So this new Q test, it's a screening test. It's a blood screening test, meaning that we are doing this in dogs that we don't know if they have cancer or not. We don't see it anywhere, maybe. And so a lot of times owners are using, or vets are using it in conjunction with, hey, let's just your dog's getting older, let's screen your dog, and they can add this on. It has only looked at 7 types of cancer. There are hundreds of types of cancer in animals, 7 common types of cancer, but it's still only 7 of the hundreds. It's looking at these, what we call nucleosomes of these cancer cells in the blood, and we're not going to talk about that. Um, that's above my level there, but that's what it's looking at. And in the studies that they've done, it's detected 50% of the 7 types of cancer. It's higher for certain types, like cancer that is more systemic. So like a lymphoma is kind of everywhere, or another one is called hemangiosarcoma, which is a tumor of blood vessels, and you have blood vessels everywhere. So it can be higher for that, like 75%. in some of those types of cancers, but that's still a pretty good chunk that isn't being detected. And so when we're screening dogs, we're usually doing it in dogs that have a higher risk of cancer. So maybe they're older, maybe they're over 7, maybe they have um, a history of it, or maybe they're more like a breed that's susceptible, like sweet golden retrievers. We know that they're more prone to certain types of cancer, and so this may be a test that your vet's discussing. So the good news about it, the positives that I see, I think there's a lot of debate, I guess I should say, in veterinary oncology about this right now and how do we utilize this test. I think that the more data we have, the more information we're going to start to gather as well about this. So this is all pretty darn new in veterinary medicine. But the positives are that we can collect blood at the same time we're doing routine blood work. So a lot of vets are adding this on when we're talking about just general lab screening, annual lab screening. The NUQ is more cost effective than the OncoK9 was. And so I don't know cost off the top of my head, and it depends on your vet, but it seems like it's a more cost effective option than it used to be. Um, and again, our goal is, can we detect cancer earlier? That's what we're trying to do. A screening test means your dog's totally acting totally healthy and normal. Can we screen or find something else? They're also using it for potential monitoring of remission of cancers or return of a cancer. So, say your dog had had a certain type of cancer, you treated it, lymphoma, they were in remission. Maybe this is a good maybe this is a good test to keep using to see if it's starting to return before your dog becomes clinical. And then again, those high risk kiddos, whether it's breed or whether there's a history of it in the line, something like that would also be potentially helpful. Negative, or maybe things to think about, um, is it really does depend on the cancer type and location. So again, this only looked at 7 types of cancer. Again, most common, pretty common ones that we see, but still only 7 kinds. And with the fact that it picked up only 50% of those total, um, together, there's a lot of false negatives. So I think we have to think about, gosh, we do this test. How are you going to feel if you do this test and great, it's negative, and then a week later your dog has a different type of cancer? Or we just missed this window enough. And so again, it's kind of a touchy situation or a sensitive situation that you have to be prepared for. This isn't, oh my gosh, 100% ruling out my dog doesn't have cancer anywhere. And then it doesn't tell you what type, it just gives you a suspicion. And so in the center, I didn't know how these tests look, but basically it gives you a value and then you interpret the value. So on the top, this was low suspicion. Okay, great. On the bottom, we're in this gray zone, moderate suspicion. What do you do with that? Well, regardless, you still need to do tests to find out what type of cancer it is and where it is. So you still have to do chest x-rays and ultrasound, those types of things to figure out what it could be and where. But it also could go up with inflammation or infection. I think that's less likely or less of an issue, as far as I can tell, but it's still something where it could be affected by other changes going on in the body. So it's one that I think that it's certainly worth discussing. One of the oncologists that I work with loves it and uses it as a screening tool and recommends it for a lot of our senior dogs. I think other oncologists are kind of on the fence as to where this goes and what we do with it. But this is the start of some really exciting things in veterinary medicine. And so know that it's an option, know that it's a tool in the toolbox, and that's what we have to go off of. So um, this gets into DNA, genetics, epigenetics in dogs, and it is so gosh darn complicated. Um, Again, more I dug into this, the more my mind is just blown, but hopefully some of this is relevant or helpful for you. So we all hopefully kind of understand or have an idea of what genetics or genomics looks like, the study of DNA and our genes and basically how we become us. And epigenetics, I think we'll start to hear this term more commonly in human medicine as veterinary medicine, but it's basically looking at external factors that can affect our DNA or our genes. So environment, lifestyle, stress, cancers, those kinds of things. This goes back to the classic like nature versus nurture study. So Stanford did a human twin study, and I think it got turned into a Netflix documentary, which I think there's some debate about that. But yeah, just basically looking at how much impact does our environment have on what happens in our bodies and how we present in the world. So breed tests, age tests, genetic marker testing for diseases at home. These are all now at our fingertips, which is cool, but it's kind of a catch 22 or one of those things we have to be cautious about because sometimes more information isn't always as helpful as we want it to be. And again, I don't work with any of these companies or anything like this, but I'm going to use a lot of these studies based on, say, Embark and Wisdom, and the Wisdom Panel or Mars because um, there's more info out there on these. So my favorite question that I get is, how old is my dog? I just adopted this dog. Tell me how old it is. And that's always a great question. I think we as veterinarians struggle with this just as much as owners do. So we all kind of, I think, know the changes that we can see with aging. So coat changes. These are my greyhounds at two different points in their lives. From left to right and then from up to down. So you can see the coat changes. They're starting to get more gray. Granted, one of my greyhounds was gray when I got her. She was 3 years old. Start to see muscle loss. I think the biggest thing that we look at is the teeth. Um, but teeth are affected by breed, by dental care, by genetics. And so that can all impact how things look as well. So it's something we can look at, but not always that helpful. This chart on the left, I love because it literally goes from 3 to 5 years. We got some moderate tartar buildup, 5 to 10 years, increased wear and disease. 10 to 15 years, teeth are worn, heavy tartar, maybe not. What if your dog's had dental work done? Who knows? So it's really kind of a subjective thing. And we can't give it a great accurate answer. Eye changes. Sometimes you'll see us say, or you'll hear your veterinarian say, oh, your dog has lenticular sclerosis or nuclear sclerosis. And that's basically a hardening of the lens. It's an aging change that we see. And it's pretty common in senior dogs. What does that mean? Your dog's older. I don't know what that means. It doesn't tell me an age. There's one study that was done with ophthalmologists on the lower left that they looked more closely at the lens. It's not something I usually do, nor know how to do. It seemed pretty complicated to me. Um, but that's it. Otherwise, we're just kind of guessing. I did take my dog to the ophthalmologist, and he was asking how old we thought Dollar was, and I said, maybe 10 to 12, somewhere in there. And he's like, yep, I would have told you that he was 11 based on his aging changes, and I'm guessing he was using this. But I was like, okay, great. So basically, we're left with maybe this range. Um, the question now is some of these DNA tests, can we use them? And this is going back there. You'll now probably start to hear this come out a little bit more. This epigenetics. Um, there are now some commercial age tests out there that you can do on your own. Same thing as some of these other genetic tests. You can swab your dog's mouth. And they're basically estimating a birthday based on external factors and changes in this. It's called DNA methylation is the most common one that I'm seeing, but it's basically they'll call it an epigenetic age of your dog. And so on the right, I know how old Tilly Terrier is. They use this EpiPause, and I think she was born February 2011. I got her she's the only dog we've ever had since she was a puppy. So I just kind of wanted to know. So I think that's pretty close, her suggested birthday. These tests were not done recently. So some of the ages might seem off, but I do feel like that fits. I'm like, okay, she's within 4 or 5 months. Cool. Dollar bill, DB is what we call him. Uh, we have no idea how old he was. I think when we got him, we thought he was, 8 to 10. He's been 8 to 10 for the past 3 years because he looks like he hasn't aged much. In a lot of ways, he hasn't grayed, all those things. So this test, the EpiPause test, estimated him at around 8 years, 10 months. That was last year. So maybe he's 10. Ophthalmologist said he's 11. Okay, who knows? And Bark actually pulled their test off and they recently brought it back. And I'm so bummed. This is how crazy I am though, because I was like, I need to do another test to see and compare it to this test that I got that said what his age was. So I am waiting on his Embark results. Supposedly, they say 77% of dogs have a true birthday within a month of their estimated birthday. Who knows? I think that this is based on we need to continue to gather more data. And so this will continue to come up, I think. So know that these tests are out there. Accuracy, how are we gonna know? We're probably not until we get more data. Um, and I bring this up because I also did my cat Dwight with this EpiPause test. And I don't know how old Dwight is. He is a shelter special. He has no teeth because his dental disease was so bad. So he's one that I'm like, I don't know. He's been returned. I'm his fourth home. So he's definitely meant to live with a veterinarian because he's got some medical issues, but he is an absolute genetic disaster of some sort. Someone created a very beautiful, weird creation with him. Um, we did this test 3 years, 4 months. And I said, no, I don't think that's right. He's got to be older. Did it again, 3 years, 11 months. He apparently has a pleomorphism, which they've never seen, which is just basically an abnormality. And I said, no, I don't think that's right. He's definitely got to be older. He's got to be older than 6 based on how many times he's been returned to the shelter. And so again, this is where more data, more research is going to have to come in. This is just one company out there doing this. And so I just want people to know that yes, it's cool, it's fun if you have some extra resources and want to put money towards this. It's a fun thing to do. I tested a dog that I knew what her age was and two that I don't really. And so this company was kind enough after we had swabbed Dwight twice and gotten they got similar answers and I said still pretty off by a couple of years. They sent me a free EpiPause test. And so with that, I've been wondering what to do with it. And I thought, how cool would it be if someone out there listening right now has a senior dog that they don't know how old they are and are maybe interested in this? If you are interested, I would love if you would send me a picture of your dog and maybe a brief story about your pup and why you want to know the age. Like, is it just a fun thing to do, or do you have anything that you have an idea of maybe how old you think they are? Anything like that. And we'll take a look if I get any stories from you guys. And if we need to decide who wins, we'll maybe have our Gray Muzzle Advisory Board help us out. And I will send you this EpiPause test that I got to test your dog. So just know that that's out there. This is the other thing that I get. What breed is my dog? These breed tests these days. Oh my goodness, I hear this all of the time. I don't, this test makes no sense. And the reason that this gets really hard, and I had no idea this was even a thing. I just thought, maybe these tests are wrong, or maybe there's not, you know, who knows, they're inaccurate. I don't know. Your dog doesn't look like a Chihuahua. It looks like a Great Dane. I don't know why it's in the breed test. Think of this as a fun thing to do, but there is a lot of research that has gone into purebred dogs. So usually when we are breed testing, all of this breed test work was done on purebred dogs, on a lot of their genetics. And dogs are the same species. So Great Dane down to a Chihuahua, same species. And so these breed tests work really well for purebred dogs or what we call the designer dogs, when your dog is maybe a mix between two purebred dogs. However, most of the time when you're wanting to know what breed your dog is, you are doing it because you have a mixed breed dog. You don't know, you have no idea. And so a lot of these companies out there, again, it's the reason that I continue to go back to some of these bigger ones is because they've actually had the money to do the research and have started to actually look at how to interpret mixed breed ancestry. a little bit more closely. And so there's data that's going into this. So if you are sending these tests out, kind of like the 23andMe, know that your dog's genetics are being used to hopefully help progress this. So most mixed breeds don't descend from purebred ancestors. They're just mixes, right? So they can be mixed with all sorts of things. And so this gets really, really tricky because a lot of mixed breeds also have, let's see here. So when you have a bunch of dogs that didn't come from a purebred ancestry, you can start to see, oh, this breed showed up and this breed showed up. Why is that? Well, these genetic markers in certain breeds are extremely strong. So I'll take the example of an American foxhound. That is an extremely rare breed of dog. Yet, if you have a hound dog, you know your dog looks like a hound, and you test it and it comes back American foxhound, the only thing that's saying is that your dog shares some traits with an American foxhound. It's not saying your dog descended from an American foxhound. And the reason is because American foxhounds, these genetic markers that they look at, some breeds, it'll show up really, really strong. So an American foxhound, their genetic markers are super strong. So if you have a hound, maybe this hound was way up here. With lots of other hound breeds and whatnot. And then as American Foxhound became a breed, and then your dog continued to have mixed breed things, the only thing is it's saying is that your dog might share genetic um, similarities with an American Foxhound based on the fact that these markers are so strong in this breed, not that it descended from it. I hope that makes some sense, but this just blew my mind because I've never understood this about why breed tests aren't like why you look and you go, huh, that makes no sense. And there's a lot more to it. Same thing, another example is the South Korean Jindo. It's actually a really common thing to show up on a breed test. However, how many South Korean Jindos are out there? I've never seen one that I can think of. And the reason is because the ancestry of your dog and a South Korean Jindo probably came from the same, somewhere up there. As they descended, your dogs became a mixed breed, and the South Korean Jindo became a breed, and they have really strong markers that show up. And so again, it gives us information, but it doesn't necessarily say, oh gosh, yep, this makes complete sense. And it's something that I again didn't know until I started seeing this or doing this research. So this is my dog Tilly. This is also demonstrates how crazy I am. I've done 3 different breed tests on her, and it's pretty consistent, I would say. So on all 3, she is Yorkie, half Yorkie on every single one. She's a quarter Pekingese on every single one. Again, that's a purebred dog, so this was easy. And then you get into the grandparents, and you're like, oh, I don't know, she's some terrier of some kind. And yep, that makes sense. She looks like a terrier, but we don't know exactly what she is. Probably because her ancestors on that side were so mixed, and it could be that her genes came before these were even breeds that were identified. So again, I think there's accuracy and in some of these in terms of or consistency, I should say. But dog genetics so confusing. The test now makes sense to me. And I don't go, oh my gosh, of course that doesn't make like, of course that's wrong. You should call them and tell them that your dog looks like a Great Dane and it says it's a Chihuahua. It makes a little bit more sense about how these tests were developed. Um, and then lastly, I just wanted to bring up the screening panels that we see. So this is dollar bill on the left. And so yes, I actually thought he had hound in him. Turns out he's 100% Labrador. He is poorly bred and a nightmare medically, but he's perfect and we love him. But I was not expecting that. He just looks like he's got a hound in him. And oftentimes we're doing these screening tests and we go, oh my gosh, look, he's clear of 100 and 209 conditions. Oh gosh, he's a carrier for one of these things. I don't even know what the Stargardt disease is. Uh, when I looked it up, doesn't matter to me. So I want owners to exercise caution when we see these tests. These give us pieces of information, but it's actually more complicated than they make it seem. Wow, your dog's clear of 209 conditions. Well, these there are a few things about these tests that come up. So most of these tests have zero to do with his breed or have been looked at in his breed. So if you just kind of glance at this list, oh, deafness and vestibular disease and Doberman pinchers, schnauzers, there's a Central Asian, so I don't even know what that is. So most of these tests, they're saying, okay, we found this gene in this breed of dog that's linked to this condition. If it's not if it's not in his breed, if it's never been documented in his breed, it doesn't matter. So telling me that he's clear of 209 conditions, or maybe I don't know, 10 of them are related to lab or have been linked to Labrador retrievers, uh, that's not helpful. So I think that it gets us excited and it's great to see, wow, he doesn't have these 209 things, but he was never going to have them anyways. So it's just a piece of information that we take from these genetic tests that we're doing at home. The other big thing is like a lot of these conditions, the the gene, there isn't just one gene that's causing this condition. Or the other big thing about these tests is that this is just a piece of a mutation, and it doesn't necessarily mean that it's testing for the whole mutation in an animal. So there are all these little snippets of things that we have to just kind of recognize that yes, this is information to have, but it doesn't always help us out as much as we think it does, or it doesn't tell us how healthy our dog is. So I'll give one example and then I'll start to finish up here. But there's a condition called degenerative myelopathy. And most veterinarians know about it. I don't know if you've had senior dogs, you may have heard more information about it. It's a pretty it's a pretty horrible disease in that it's progressive and it's a neurologic issue where they can start to lose function. Kind of starts in their back end. It's similar to ALS or Lou Gehrig's disease in humans. So it's an animal model of that. And it's, sorry, I'm watching my cat. This is the other thing I should have warned you about. The animals are always involved in presentations here, Gray Muzzle too. So this disease is actually quite rare. Most commonly, the breeds that we see it in are German Shepherds and Boxers are kind of the poster children for it. Um, and what's interesting is that it's actually the most common mutation that we see, the common change that we see in these genetic tests. So it's found in a frequency of 7.8% in mixed breed dogs and 5.4% across purebred dogs. It's super, super rare. So why is this rare disorder, like why do we not see this very commonly, but it's the most frequent mutation we find on these tests? And again, there's a lot that goes into this. I liken this, the wire fox hair terrier, they see this mutation in over 90% of wire fox hair terriers. However, it's only been actually documented, the disease itself has only been documented in a handful of these wire fox hair terriers, more commonly again in German Shepherds and Boxers. So what does this mean? This means that, gosh, could this disease be related to more than one gene? We think that it is. Um, just because you have a gene marker that's abnormal does not mean you're going to get the disease. And so that's the hard part about this. Like, look at the wire fox hair terriers. It's very, very common to see this abnormality, but we're not commonly going to think, oh, they're going to get this condition. So there is so much more that goes into this behind the scenes that we have to understand, especially as consumers, as we're looking at this and going, oh my goodness, my dog could be at risk for degenerative myelopathy. Your dog could have the genes for it. The other thing about it is that we don't know when they're going to get the disease. It's not something that they're born with, it's something that happens later on in life. So, gosh, could they get it at 8 years old? Could they get it at 15 years old? Could they never get it because something else, affects their quality of life sooner? There's so much that goes into this. And so I feel like it's almost unfair sometimes to put this into the world and say, look, your dog doesn't have any of these things, or, oh gosh, it's a carrier for this. So I think it's something to help us get more information, but it doesn't necessarily mean that we should be making choices based on this information. Dollars, it's got horrific hip dysplasia, you've got cancer, 5 different types of cancer, and I'm really glad he doesn't have some of these 209 things that he was never going to have. So I wanted to say, so what do we do? We do have fun with these. I think these are fun, useful tools, but I think talking to your vet about options, or if you find something on one of these tests, you do it, talking with your vet about it. When is genetic testing really, really important? Breeding and working animals, I think incredibly important to know their genetic health and genetic diseases and try to prevent that as much as possible. Or if you're getting a new puppy, knowing kind of what those tools are and what we should be looking for. And then knowing where to look for more information. So I'm going to come out really quick and just show you the Canine Health Information Center. um, you may have heard about this for things like um, hip disease. Like we'll look for hip dysplasia, and there are a lot of other genetic diseases that we know about. So that's important information. But I love this site because they do have on their general program, if you go to or their website, DNA based disease tests. And if you scroll down here, you can actually see, oh gosh, there's one for degenerative myelopathy. And it tells you about the disease, it tells you about the research behind it, and it tells you about information about the results, DNA results. And so it also tells you what breeds it's been linked in. So again, if you get a dog, if you have a dog that isn't on this list and comes back positive for that marker, then it probably isn't going to be clinically useful, nor may it ever be, even if your dog does have a marker for this. So talking with your vet about it and then knowing where to get that information, I think is really important. So along with that, I think that's pretty much it. I did list my some resources here. I did put my email down here. I know there's a ton of information that this covered. Again, some of these questions that you guys have, I probably won't be able to answer, but I'm happy to try, but just know that you're a veterinarian, and really, again, going back to that spectrum of care is probably the most important thing when you're making decisions about your senior dog. So, and I don't, again, resources, we'll send this all to you so that you guys have it as well. Okay. Thank you guys so much. now have a cat in my lap. I don't know. He was making his debut, and I was freaking out that he was going to knock over everything, but he decided to cuddle up. So hopefully that was helpful.
He just wanted the loving. So thank you
That's
so much,
right.
Dr. That was really informative. And I mean, well, first of all, I have
Mhm.
to say, I think everybody watching is going to agree with you that Tilly Terrier is extremely cute. So keep on taking those photos. But
She's adorable.
I think kind of wrapping up what you said is one of the things I always like to say is that we need to think of our veterinarians as our pet's second best friend. We have to be the first.
Mhm.
And if we really trust and have a veterinarian that we feel have a lot of faith in, we do have to rely on them because, man, 10 years, 20 years, 100 years from now, some of these tests are going to be amazing and we can find out stuff, but we're not quite there with everything yet. So,
Yes, yes, exactly. And I think the another point to go along with that I always go back to is just because sometimes we get that information, but that doesn't mean we always have to, you know, do anything crazy with it. Just because my dog has a marker for something doesn't mean I have to go do an MRI, or maybe I want to do an MRI. But I think knowing your options and feeling like you have that open communication with your vet and your family, or whoever else you feel like is important in your life, making these decisions is that's really important, because it really is about you and your furry friend. So
absolutely. Well, let's get to these
yeah.
questions. Before we do,
Mhm.
so kind to offer that EpiPause test. Can we pick a
Oh,
deadline? Because, some people will watch this in recording.
ah,
So do they need to have, I don't know what you want to do?
let's see. I wonder if by December 1st,
I
if
think
that
that's great.
seems reasonable. That's a great call out to me. So we'll say by December 1st, if you've listened to this and are interested and want to send me an email, you can also send it to the if you don't find my email, you can send it to Gray Muzzle and we'll make sure that it gets to me too. So we'll make
Terrific.
sure that there's a fair way to assess these wonderful stories coming through.
That will be so fun, and thank you for that. So,
Yeah.
for starters, after I lost my dog Vixen to a tumor on her spleen, I found out about
Mm.
vaccination for cancer in dogs. Do you know about this vaccination?
Um, there are a few different ones coming out. I don't know specifically. The hard part about it is so many different types of cancer. And so there are a few vaccines like the melanoma vaccine. That's one that I can think of. Uh, a tumor on the spleen, sometimes that's a hemangiosarcoma, and there aren't vaccines for that yet. I think this is also going to continue to be. Sorry, we're about to have a terrier. She's really cute, but she doesn't like the cat sometimes. um, so I think that it very much depends on the type of cancer. I do think we are getting more of these vaccines out. You'll hear about it in human medicine too. We call it immunotherapy. But the one that I can think of right now that's most commonly utilized is for melanoma. And my guess would be is that your kiddo didn't have a melanoma. Um, but it's hard to say. And that's the hard part is that all of this oncology research in animals is quite new, actually, because a lot of times before, if your dog got sick, we aren't doing the things that we used to. You'd say, "Oh gosh, my dog's been sick," and that's it. Or, we didn't have the tools or capabilities to say, "Hey, we can do chemotherapies and this and that." The one thing I would say is that the new Q test does does look at hemangiosarcoma, which is probably one of the most devastating cancers because it does not always show up very easily. Sometimes we find it by the like when it's too late. And so that is a screening test that may become more commonly utilized for that type of cancer. And again, I don't know what type of cancer he had, but a lot of times a tumor on the spleen is most often associated with hemangiosarcoma, and that's just a horrible cancer all the way around. So I'm so sorry. Um,
We all have to be careful too about not beating ourselves up about why didn't we know about this or if only we had done that, because these things are still happening in the human world too, and some things are just
yep.
surprises doctors don't know. So do the
Yes,
best we
that's
can
a
with what we have.
yes, and I think that's a great point to make, Denise, because one, animals hide their disease so much better than we do as humans. I actually think humans are kind of wimps about diseases and feeling sick or off. Um, but our animals, I mean, especially I feel like cats, to be honest, being so recently domesticated, they had to feel fine or they were going to get eaten. And so re- recognizing pain and discomfort or something's off in your animal can be really, really hard. And sometimes they are totally normal until they're not. And that is no fault of you. That's no fault of your veterinarian. A lot of times these things happen so fast. I liken it to lymphoma case where blood work was normal 1 week before, and then a week later, total difference. And it can really happen that fast. And I'll use one other example, and I apologize if people need to jump off. We'll continue to record this. I know we're a little bit over time, but I'll use the example of Tilly Terrier. I know that something is wrong with her, and we cannot figure it out. And I'm at a place where, yes, I have the resources and the tools to be able to do a lot of the things, and she's insured, so she's had an MRI, she's seen the cardiologist twice, she's seen internal medicine, she's had 3 ultrasounds this year. Something is wrong and no one can figure it out. And I think I said this in my last talk, it's kind of like Dr. House, like we see these cases all of the time, and I feel fortunate to have done what I've been able to do for her, but we still don't know what's wrong with her. And so know that sometimes you can do all the things in the world and still not know. Um, but yeah, you should not feel bad. Like if I would take it back, I would have not put her through an MRI. Um, because we didn't find anything and we're still in the same place. So it's frustrating. And I just feel that for as an owner and for owners as we talk about options and where to go with things with our pets.
Well, thank you for that. We'll wrap this up.
Yeah.
Let me just give you, they love the spectrum of care image. So thank you for that.
Oh,
Here's
yes.
a comment that I really love. I call my dog Forever 10 because that's what she was when we adopted her from the shelter 3 years ago. So I think that's a nice way of putting the age on it.
Yes, I love that.
And there was one about a test. Here it is from Judith. My 15-year-old Chihuahua mix had the Onco K9 test about a year ago. Very expensive and not covered by insurance. Later found out it really couldn't detect if her cancer had returned.
Yeah. Yep. And that's exactly, I think, where we're at with the new Q test. We don't quite know what to do with it. Again, I'll go back to that example that the one test it was done and it said moderate suspicion for what? And now we have to do all of these other tests to figure out, could there be something? Is there not something? How do we monitor it? We don't know all of that information yet. So it's exciting. The new Q is much less costly, I think, than the Onco Canine is. But that's again a discussion with your vet. Would I personally rather put money towards doing a different test if I was suspicious, potentially. If I had extra resources and they were drawing blood anyways, I might be like, okay, sure. I have a dog that Dollar, he's had 5 different types of cancers. They've all been like on his skin. And one of the tests is the Nu-Q does mast cell tumors. I'm not going to test him for that because I don't think the yield is going to be that high. So it's information, but as to what we do with it, it's hard to say right now, those answers. All I can hope is that things will get better and better the more information we gain as we go. It's still all pretty new. So I'm sorry that you had to go through that experience. It's a lot to go through all of that financially and emotionally as well too. So
Well, and
mhm.
thank you so much. And since it's here, you just answered or talked about Judith's question, and her dog is having surgery tomorrow. So I thought we could just all put it
Aw.
for her doggy and hope that all goes well. But Dr. Ackley,
Oh.
thank you so much. There's, so much more I know you have to say, and we would be willing to listen, but I think people are getting off their lunch hours and everything else. But this is in
Yeah.
recording, so it'll be there for posterity. And thank you for your knowledge. And we're going to bring you back for more webinars.
Awesome. I'm there for it. Thank you all. And again, feel free, you can email me with questions. I'm happy to try to answer if I can. Or and I'll say I don't know if I don't. So yeah. But
There you
thanks
go.
for joining.
First deadline for the EpiPause test.
Thanks everybody. Take care. Bye.